Hi, my name is Johanna Mucke and I'm from Düsseldorf in Germany. I did a survey among patients with lupus on TreattoTarget, which I'd like to present. So I did this project last year in Amsterdam, and I'm working on TreattoTarget mainly in Germany. So TreattoTarget means picking a treatment target which we aim at with our therapeutic treatments, which usually is remission, so the lack of disease activity. And we do know that TreattoTarget is a very sensible and reasonable approach in lupus, and that it does improve the outcome. But what we don't know is what our patients actually think of TreattoTarget. And this is why we conducted a survey among patients that was designed with a patient research partner. We distributed it among 4 different countries via the patient organizations, so among the Netherlands, Germany, Austria and Bulgaria. That was exactly last year. It consisted of 13 questions. And in total, we had more than 800 respondents, which was a very high amount of patients. And the first question that we asked was if the patients felt being in remission, so had no disease activity. And it was more than half of the patients that said yes, they were considering themselves being in remission, but there was still a substantial number of 35% of patients who said they were not in remission. So a very fair amount. And also when we asked for the satisfaction with the disease and the current treatment, with the disease state and the current treatment, it was similar. So more than half said that they were actually satisfied with their disease state and the current treatment. But again, among between 12 to 17% said that they were not at all to somewhat satisfied. So I think this is the major point of my research or of the survey, that while half of the patients are very satisfied, the other half is not, or a third is not, and this is something that we have to improve. And another aspect was if the patients would be willing to participate in a TreattoTarget trial, and this is something that question was answered positively by among 2/3 of the patients. So treatment on research on TreattoTarget was considered very important, and 2/3 would participate in the trial. So this is something very positive because we are planning a trial on TreattoTarget. And one last thing is major advantages or disadvantages of TreattoTarget, because that is also something very important. And while most aspects of TreattoTarget were considered important, the only things that were seen a bit critical were the possibility of more doctors' visits and the possibility of a new immunosuppressive drugs that was seen a bit critical by some of the patients. But other than that, a reduction in steroid dose and treatment control by TreattoTarget was seen very positive, and I am very positive about that because I think TreattoTarget is a great approach and we'd like to further study it, and we need you, the patients, for that.